Hello, my name is Dr. Brian Raid, and I am a naturopathic doctor, and this is a video about dermatographia. This is a word that most people have probably never heard of unless they're affected by it or they went to naturopathic medical school or some other type of clinical training program. But basically, dermatographia, just breaking down the word, dermato pertaining to skin, graphia pertaining to drawing, essentially, is basically this phenomenon that we've all probably experienced to some extent, where if you run your fingernail or something that's just mildly sharp along your skin, it'll leave a little line behind. But folks with full-blown dermatographia, it will leave a red mark behind, sometimes for minutes or I mean, maybe hours in some cases, in more extreme cases. And in and of itself, it isn't necessarily a terrible symptom to be experiencing, but it is a clue in some cases that there might be some more significant health issue afoot. So as per usual, please don't take anything I'm about to say as medical advice. Please consult with your personal healthcare provider prior to making any medical decisions for yourself. But a question came in about dermatographia on one of my other posts, and so I'm just going to read that out here. It says, question, dermatographia. If a person has this, does this suggest a histamine disorder? Generally speaking, with dermatographia, I'm sure that there are cases where folks have dermatographia and it's not related to a full-blown histamine disorder. I've certainly had some patients where they are able to draw on their skin and they don't have a whole whack of different histamine issues. Is it histamine mediated? To my understanding, yes, it is. And in my experience, most folks that I work with, have chronic health issues. So a lot of them with dermatographia have histamine-related disorders, but I don't think it's mandatory that one has a histamine disorder if they have dermatographia. But in my experience, commonly the two are associated. And let's see here. So does this suggest a histamine disorder? Certainly could. Underlying infections, possibly. The question is always, well, what's driving that histamine in the first place? And underlying infections with things like the Lyme disease causing bacteria, Borrelia burgdorferi, or Bartonella, or Babesia, or other infections could certainly drive histamine-related issues in some patients. Moldy environment to mold illness, absolutely. A mold is very good at triggering mast cells to release histamine into the body, so it could certainly be associated with mold and mold illness. And can this symptom be related to female hormone disorders like irregular menstrual cycles or differentiation in breast size? So I can't really speak to the differentiation in breast size, but in terms of being related to female hormone disorders like irregular menstrual cycles, it certainly can be. There's a really interesting link between estrogen and histamine, and specifically when there's more when there's more estrogen activity in the body, then that will cause more histamine activity. It actually sensitizes histamine receptors to be more biologically active. So in females who have, or males for that matter, who are experiencing higher levels of estrogen for some reason, whether it's a certain point in their menstrual cycle or they have an estrogen dominance for some reason, then they are going to be more prone to having extra or increased histamine activity because of the presence of that estrogen. And so in many of the patients I've worked with where they have worse symptoms in, say, their premenstrual period, which is a time where if an individual has a harder time breaking down the estrogen in their body, that it will tend to circulate around more. Sometimes it's in that premenstrual period that symptoms are the worst, and that can be related to histamine because it's more biologically active due to the elevated levels of estrogen that are just taking too long to get broken down due to whatever underlying issue there might be with estrogen metabolism. So I've seen a significant correlation there. So with dermatographia, aside from being a fantastic Scrabble word, if you put down dermatographia, you just win Scrabble, like for all time, if you can manage to get that one on the board. But outside of that, it's not harmful in and of itself, but it can certainly be a clue that there's an underlying histamine-related issue. When I'm screening patients for, when I'm doing a patient intake, I'm screening them for whether they might have histamine-related issues. I don't oftentimes ask about, can you draw on your skin and does it leave red marks behind? I'll usually lead with things more like, when you get a bug bite, does it tend to really blow up a lot more than it does for the average person, or do your bug bites take longer to go away, tend to be larger than average, that kind of thing. Or certainly asking whether consuming high histamine foods are bothersome for them. Do you have a lot of congestion or allergy type symptoms, that kind of thing. But it certainly is a relevant, it would be certainly a relevant clinical feature if they had dermatographia that would really point things in the direction of there being a histamine-related issue, in my experience. So thank you for the question. It's a great question. I don't oftentimes get to talk about dermatographia on social media. I think this is the first time, actually, so it was a joy. If there are any questions on this topic or on anything else, please post them in the comment section below. And if you are not already following me or subscribing to my videos on YouTube or Instagram or Facebook or wherever you happen to be watching this, I'd appreciate it if you would, please and thanks. And if you don't mind liking the video as well, that would be appreciated. It's always nice to see that because it lets me know that people actually like my content, and it inspires me to make additional videos. So showing that social media love is much appreciated. So I will leave it there for now.